If you're in medical school, you know the feeling. The pressure is just relentless. But what if the secret wasn't about studying harder? What if it was about studying smarter? Well, today we're going to break down the science-backed strategies that will completely revolutionize how you learn, boost your performance, and maybe, just maybe, give you your life back. And it all really starts with this idea right here, this core mindset shift. See, excellence in med school, it's not a measure of your innate genius. It's a test of your strategy and your discipline. And that changes everything, right? It moves the goalposts from who you are to what you do. And what you do, well, that's something you can absolutely master. And the payoff for mastering that strategy, it is huge. I mean, just look at this. The data shows that students who really adopt these evidence-based methods can see their performance jump by up to 30% over those using the old traditional techniques. That's not just a slightly better grade. That is the difference between barely surviving and actually thriving. So you might be asking, what makes medical school so different that it needs this complete strategic overhaul? Let's just call it what it is. It's the med school mountain. And trust me, it is a unique kind of climb. Yeah, this isn't just one tough semester. We're talking about a massive, unbelievable volume of information, and you can't just memorize it. You have to integrate it into complex clinical reasoning. Oh, and it needs to stick with you for years, ready to be recalled in a split second when a patient's health is on the line. It's a completely different beast. So how in the world do you conquer a mountain like that? Not with brute force. That's just a one-way ticket to burnout. Nope. You do it with the right gear. And today, we're equipping you with 4 essential, scientifically proven tools to make that climb faster and a whole lot smarter. First up, spaced repetition. Okay, think of your memory less like a filing cabinet and more like a muscle. You want to make it stronger, you need consistent, timed workouts. This technique does exactly that. It fights your brain's natural desire to forget things by making you review information at strategically increasing intervals, right at the moment you're about to forget it. And each time you do that, you lock it in just a little bit deeper. And the results? They're not just good, they're phenomenal. We're not talking about some tiny improvement here. Compared to that all-night cram session we've all done, spaced repetition can boost your long-term retention by 200 to 300%. It is a fundamental game changer for building lasting knowledge. All right, our second tool is active recall. And this gets to the heart of a mistake we all make. We spend hours rereading notes or highlighting text because, it feels productive. But the real deep learning, that happens when you force your brain to actually retrieve the information from scratch. Things like quizzing yourself, or even better, trying to explain a really complex topic out loud to someone who isn't there. And the performance gap between these two approaches is just massive. The simple act of pulling information out of your brain instead of just passively shoving it in can increase what you actually retain by 50 to 80%. That's an incredible return on investment for your study time. Tool number 3 is something called interleaved practice. This is all about intentionally mixing things up. So instead of a 3-hour block studying just cardiology, you might do an hour of cardiology, then switch to an hour of pulmonology, and then maybe an hour of renal medicine. Now, it's going to feel harder in the moment, for sure, but that's the whole point. It's preparing your brain for the chaotic reality of clinical work. So why does that difficulty lead to better learning? Well, think about it. In the real world, patients don't show up with a textbook chapter title on their forehead. You have to figure out what's going on. Interleaving hones that exact skill, and the data shows it can improve your problem-solving and diagnostic abilities by 25 to 40%. You're training your brain to see the patterns, not just to memorize isolated facts. And our final tool is elaborative interrogation. It sounds really fancy, but honestly, it's just about the disciplined habit of asking 2 simple words over and over again. Why and how? Why does this drug cause that specific side effect? How does this disease actually mess with normal physiology? This constant questioning is what separates deep, lasting understanding from that fragile surface-level memorization. And that constant search for a deeper understanding, it pays off big time. Students who consistently ask why and how see up to a 40% improvement in both their comprehension and their retention. You see, you're not just collecting facts anymore. You're building this intricate, interconnected mental map of the human body. Okay, so we've got the gear, right? Spaced repetition, active recall, interleaving, and elaboration. Now, how do we pack it all into an efficient, repeatable routine you can actually use every day? Let's build the framework for a perfectly optimized study session. Try structuring your study blocks into 3 clear phases. First, you start with a quick 5-minute prep. What is my one specific goal for this session? Then you dive into a super focused 25 to 45-minute active learning phase. This is where you're using active recall, you're asking why, and then, maybe the most critical part, you end with a 10 to 15-minute consolidation phase. This is where you summarize, test yourself, and really lock in what you just covered. Now let's zoom out from a single study session and look at the bigger picture. With this insane amount of information coming at you, how do you apply these principles to manage it all and, this is crucial, connect it directly to what you'll be doing in the clinic? The key is strategic triage. You simply cannot treat all information as equally important, so using a hierarchical system like this is essential. First, you relentlessly master the level 1 must-know concepts. This is the absolute bedrock of the topic. Only then do you start to layer on the level 2 should-know details. And those level 3 nice-to-know extras? That's bonus material for if and only if you've completely solidified the first 2 tiers. This is how you keep from drowning in detail. And here is a fantastic method to actively practice that triage and connect it all to the clinic. For every major disease you study, frame your knowledge using the SOAP note structure. Subjective, what will the patient actually say? Objective, what are the key lab results and exam findings? Assessment, what's my differential diagnosis and why? And plan, what's the treatment? This literally forces you to stop being a passive student and start thinking like an active clinician. But listen, none of these tools or frameworks will matter one bit if you burn out halfway up the mountain. The final and maybe the most important piece of the puzzle is cultivating the right mindset. This journey is a multi-year marathon, and that requires a totally different mental approach than a sprint. And this slide really lays out the critical choice every single student has to make. You can follow the path of perfectionism, which, let's be honest, inevitably leads to burnout, anxiety, and just feeling paralyzed. Or you can choose the path of sustainable excellence. This is about prioritizing progress over perfection, about mastering the essentials and building consistent, healthy habits. It's about being strategic, not just trying to be flawless. And when setbacks happen, because they will happen, to everyone, you have a choice then too. You can see it as a personal failure, or you can see it for what it really is: valuable data. Analyze what happened objectively, look for patterns in your approach, proactively adjust your strategies, and never, ever hesitate to reach out for support. This is how you forge true, unshakable resilience. So, we've covered a ton of ground, right? From the 4 essential tools for your climb, to the frameworks for planning your route, to the mindset that's going to keep you going. The evidence is clear. Now, the power really shifts to you. And don't get overwhelmed trying to change everything at once. Just look at what we've talked about and ask yourself this: what is the one single change I will commit to making in my study routine starting tomorrow? Because that one small step, that's the beginning of an entirely